Hello guys, welcome back to Boring Historian. Tonight, we are stepping into a world lit by flickering candles and smelling faintly of mysterious herbs and illness. We are exploring the strange, fascinating, and often terrifying world of medieval medicine. Imagine you are lying on a straw-stuffed mattress, a fever prickling your skin. The physician arrives, not with a stethoscope or a syringe, but with a grave expression and a glass flask, waiting for a urine sample that he will examine with the intensity of a fortune teller gazing into a crystal ball. What you're about to hear might stick with you, and it will almost certainly make you deeply, profoundly grateful for your boring old bottle of aspirin. If you're picking up what I'm putting down, go ahead and hit that like and subscribe button. It's always a thrill to see where you're all listening from. So whether you're tuning in from my current home in Vietnam late in the evening, or from somewhere in Europe, or the Americas earlier in your day, please drop your location and local time in the comments. All right, find your quiet space, let the outside world fade, and let's begin our journey. You are not well. You wake up one morning with a pounding head, an aching in your bones, and a fever that leaves you alternating between shivering chills and sweats that soak your linen shirt. In our modern world, your mind would immediately jump to familiar concepts. Is it a virus? A bacterial infection? The flu? But you must now forget everything you know about modern medicine. You must erase from your mind the very existence of germs, of cells, of DNA, of all the microscopic agents that we know cause disease. In your world, sickness is not a foreign invasion. It is not something that attacks you from the outside. Sickness is a disruption from within. It is a sign that your own body, your personal internal ecosystem, has fallen out of balance. To understand every single medical treatment we are going to explore on this journey, from the bizarre to the brutal, you must first understand the foundational theory that governed all medical thought for over 2,000 years. It is an elegant, comprehensive, and beautifully logical system that explained everything from your personality to your physical health. It is the theory of the four humors. This theory, first developed by the ancient Greeks like Hippocrates and later refined and encyclopedically documented by the Roman physician Galen, was the absolute, undisputed bedrock of all medicine. It was passed down to medieval Europe through the great Arab scholars who had preserved and translated the classical texts. To question the humoral theory would have been like questioning that the sun rises in the east. It was simply the way the universe worked. The theory begins with a simple, poetic idea. Your body is a microcosm, a small-scale reflection of the universe. The macrocosm. The universe is composed of four fundamental elements: earth, which is cold and dry; air, which is hot and moist; fire, which is hot and dry; and water, which is cold and moist. Your body, being a perfect little universe, is therefore also composed of four corresponding fluids, or humors, which share the qualities of those elements. The first humor is blood. It corresponds to the element of air, and therefore its essential qualities are hot and moist. It is the vital fluid associated with life, warmth, and vigor. The second humor is phlegm. It corresponds to the element of water, making it cold and moist. Now, in your mind, phlegm is not just the mucus you cough up when you have a cold. For the medieval physician, phlegm was a much broader category that included many of the clear or white fluids of the body, like saliva, sweat, and plasma. It was associated with sluggishness and tranquility. The third humor is yellow bile, also known as choler. This corresponds to the element of fire, and so its qualities are hot and dry. This was believed to be a fiery, acidic fluid secreted by the liver, associated with energy, anger, and digestion. The fourth and final humor is black bile, also known as melancholy. This is the most mysterious of the four. It corresponds to the element of earth, making it cold and dry. It was thought to be a dark, thick fluid secreted by the spleen and the gallbladder. It was associated with seriousness, introspection, and sadness. While the other three humors could be readily observed, you could see blood. You could spit phlegm. You could vomit bile. Black bile was a more theoretical substance, a kind of dark sediment that was blamed for a host of ailments. According to this magnificent theory, your health is a state known as eucrasia, which means a perfect and harmonious balance of these four fluids within your body. You have just the right amount of each humor, and each humor is in its pure, uncorrupted state. Sickness, then, which was known as dyscrasia, is simply a state of imbalance. Every single disease you could possibly suffer from a simple headache to a raging pestilence, was diagnosed as the result of one or more of your humors becoming excessive, deficient, or corrupted. The entire purpose of medicine, the physician's only real job, is to identify the nature of this imbalance and to help your body restore its natural, healthy equilibrium. But the theory goes even deeper than that. It doesn't just explain your physical health. It explains your personality. It was believed that every person is born with a natural, unique humoral makeup, an innate tendency to have a slight surplus of one particular humor. This personal balance was known as your complexion or your temperament, and it dictated your character, your emotions, and your physical appearance. This was, in essence, the original personality test, the medieval equivalent of the Myers-Briggs or the Enneagram. If your dominant humor was blood, you were said to have a sanguine temperament. You were the life of the party, cheerful, optimistic, sociable, and energetic. You likely had a rosy, reddish complexion and were prone to laughter, but you were also susceptible to illnesses caused by an excess of heat and moisture, like fevers. If your nature was dominated by phlegm, you were phlegmatic. You were the calm, quiet, and thoughtful one. You were peaceful, patient, and not easily roused to anger or passion. You might be physically pale and a bit soft-bodied, and you were naturally prone to cold and moist conditions like colds, coughs, and respiratory ailments. If you had a natural excess of yellow bile, you were choleric. You were a fiery, ambitious, and energetic personality. You were a natural leader, driven and decisive, but also quick to anger, irritable, and aggressive. And finally, if your temperament was governed by black bile, you were melancholic. You were the serious, introverted, and artistic soul. You were prone to deep thought, intellectual pursuits, and powerful feelings of sadness or depression. You were the classic brooding poet or the solitary scholar. So now, lying in your bed with a fever, you can begin to see how your physician thinks. He knows you have a naturally sanguine temperament, so you are already predisposed to an excess of hot and moist blood. This fever you are experiencing is a clear sign that this natural tendency has gotten out of hand. Your body is suffering from a dyscrasia, a corrupt overabundance of the blood humor. But what caused this imbalance? It certainly wasn't a germ. A physician would investigate the 6 non-naturals, a checklist of 6 lifestyle and environmental factors that could disrupt your delicate internal ecosystem. These were the air you breathe, the food and drink you consume, the balance of sleep and wakefulness, the balance of motion and rest, the processes of excretion and retention, how your body gets rid of waste, and finally, the passions of your emotional state. Perhaps you have been breathing in bad air, a miasma, which has corrupted your blood. Perhaps you have been eating too many foods that are also classified as hot and moist, like red meat or rich wine, adding fuel to your sanguine fire. Perhaps you have not been getting enough rest, or you have been experiencing too much joy or anger, both hot emotions that can agitate the blood. The physician's job is to be a detective, to investigate your life and your environment, to find the root cause of your specific humoral imbalance. When the physician arrives at your bedside, his methods are strange to a modern eye. He is a man of immense learning, but his knowledge is almost entirely theoretical. He will likely not touch you very much. He sees himself as a philosopher of the body, not a manual laborer. He will observe you closely, noting the flush of your skin and the pace of your breathing. He will ask you a long and detailed series of questions about your diet, your sleep, your work, and your emotional state. And most importantly, he will demand a sample of your urine. He will hold the flask up to the light, examining the color, the clarity, and the sediment within, a practice we will explore in much more detail later. For now, it is enough to know that he believes your urine is a window into the state of your humors. Once he has gathered all this information, he will make his diagnosis. In your case, it is clear. You have a surplus of the blood humor. Now he must devise a treatment, and the guiding principle of all medieval medical treatment is beautifully simple. Allopathy, or the doctrine of opposites. Hot diseases must be treated with cold remedies. Dry diseases must be treated with moist remedies. This is the absolute key, the secret decoder ring that unlocks the logic behind every bizarre and dangerous treatment we will encounter. A fever, which is a hot condition, must be treated by cooling the body. The best way to do that, your doctor reasons, is to remove the excess hot fluid. Therefore, he will prescribe a treatment to remove blood from your body. A common cold, a cold and moist condition, will be treated with remedies that are hot and dry, like pungent spices or warming herbs. Everything is about restoring equilibrium by applying the opposing force. Their medicine was not random. It was not a collection of superstitious folk remedies, though it often incorporated them. It was an intensely logical, rational, and intellectually coherent system. It explained everything, from the changing of the seasons to the depths of human personality to the cause of every possible illness. It gave both you and your doctor a sense of order and control in a frightening and unpredictable world. The only problem, the single fatal flaw at the very heart of this magnificent intellectual palace, is that the foundational premise was completely and utterly wrong. But how much did you, the patient, actually understand about this complex system? Was the intricate theory of humors, complexions, and the 6 non-naturals something that only a university-trained physician in his long robes could comprehend? Or did a simplified version of this worldview permeate all levels of society? This is a point that historians still argue about. The argument that it was a system for the elite is strong. The detailed knowledge, the ability to read the Latin texts of Galen and the Arabic texts of Avicenna, the complex classifications of foods and herbs, this was certainly the exclusive domain of the highly educated. Your average peasant farmer could not afford a physician and would not have understood his complex terminology. However, the basic principles of the theory undoubtedly filtered down into the folk wisdom of the general populace. Your grandmother, who might act as the healer in your small village, would not know the word phlegmatic, but she would absolutely tell you to treat a chesty phlegmy cough with warming remedies like a poultice of hot mustard and onions. She would understand the fundamental concept of treating an ailment with its opposite. Common phrases that survive even today, like to have a sanguine outlook or to be in a black mood, are the faint, ghostly echoes of this once universal system for understanding the world. A person's temperament was common knowledge, and the idea that certain foods were cooling like cucumbers and others were heating like wine and spices was part of the basic culinary and medical knowledge of the day. The simple version of the theory was everywhere. And so you lie in your bed, your body burning with a fever. You now understand how the world of medicine sees you. You are not a patient with an infection. You are a finely tuned instrument whose harmony has been disrupted. You are a small universe that has been thrown into a state of imbalance. You understand that every treatment your physician is about to suggest, no matter how strange or painful it may seem to us, is, in his mind, a logical and necessary step on the path to restoring your personal, internal, and vital equilibrium. The theory is elegant. It is comprehensive. It gives you and your doctor a shared language and a clear plan of action. It offers a sense of control and hope in the face of suffering. The problem, of course, is that the entire magnificent intellectual edifice is built on a foundation of pure sand. And the treatments derived from this flawed theory are at best useless and at worst actively harmful. With this powerful but profoundly mistaken theory as our guide, we can now begin to explore the most common, most iconic, most universally applied, and most dangerous of all their treatments, the grim and bloody practice of bloodletting. With this flawed but powerful theory as our guide, we can now begin to explore the most common, most iconic, and most dangerous of all their treatments, the grim and bloody practice of bloodletting. Your physician has made his diagnosis. Your fever, your aches, your general feeling of malaise is all caused by a corrupt overabundance of the blood humor. Your internal ecosystem is flooded with a fluid that is too hot and too moist. The logical, rational, and scientific solution is therefore obvious. You must remove the excess. This procedure, known as phlebotomy, was not seen as a violent or desperate last resort. It was the absolute cornerstone of medical therapy for over 2,000 years. It was considered a gentle and effective way to calm the body, to purify the system, and to restore the delicate humoral harmony that was the very definition of health. It was used to treat almost every condition imaginable, from fevers and headaches to indigestion, gout, and even emotional states like mania or deep sorrow. If in doubt, the medieval physician would almost always prescribe a bleeding. But the physician himself will not be performing this procedure. As you know, he is a man of theory and intellect, a philosopher who does not engage in messy, manual labor. For the actual physical work of opening a vein, you must call upon a different kind of practitioner. You summon the local barber surgeon. This man is a craftsman, not a scholar. He likely cannot read Latin, but he has a deep practical knowledge of the human body's exterior. He is a member of a guild, and his daily business involves a host of hands-on services. He is the man you go to for a haircut or a shave. He is also the man you go to for pulling a rotten tooth, for setting a broken bone, for stitching a wound, and most frequently of all, for performing a therapeutic bloodletting. He is the blue-collar worker of the medical world, and he arrives at your bedside with his specialized toolkit. You watch as he unrolls a leather pouch, revealing the tools of his trade. You see the gleaming, sharp point of a lancet, a small, double-edged knife designed for making a quick, clean incision in a vein. You might see a fleam, a fearsome-looking instrument with several small retractable blades of different sizes. The fleam would be placed over the chosen vein, and then struck sharply with a small wooden mallet, a technique that allowed for a very fast and standardized puncture. And he will have his bleeding bowl, a shallow dish made of pewter or brass, often with graduated markings on the inside, to measure with precision the amount of blood being drawn. Your physician has not just ordered a bleeding. He has prescribed an exact quantity, perhaps 6 or 8 ounces, that must be removed to restore your balance. The barber surgeon now begins the procedure of venesection, or the opening of a vein. He examines your arms, looking for a suitable site. The most common and preferred location is the median cubital vein, the prominent vessel in the crook of your elbow, a place where the vein is stable and easy to access. But the choice of vein was often far more complicated than that. It could be dictated by the location of your ailment, following a complex system of correspondences. A pain in your liver might call for a bleeding from the right arm. A headache might require a bleeding from the forehead or temples. This decision might also be influenced by astrology, a topic we will delve into later, where certain veins were believed to be under the influence of certain planets or zodiacal signs. For your fever, however, the arm is the standard choice. The barber surgeon ties a strip of cloth tightly around your upper arm, acting as a tourniquet. He instructs you to pump your fist, and you watch as the vein in your elbow becomes thick, dark, and prominent. He takes the lancet in his practiced hand and, with a swift, decisive movement, makes a small, sharp cut. You feel a sting, and then a strange warmth as your own life force begins to flow out of you. The barber surgeon holds the bleeding bowl beneath the cut, and the dark warm blood streams into it. He watches the rising level with a practiced eye. As the bowl fills, you begin to feel a profound change in your body. The world starts to seem distant and a little fuzzy. You feel a growing sense of lightheadedness, a gentle, floating weakness that spreads through your limbs. To a modern observer, these are the clear and obvious signs of blood loss and impending shock. But to you and your medieval practitioner, this sensation is a positive and welcome sign. The weakness you feel is the bad humor leaving your body. The lightheadedness is your over-agitated, hot system being calmed and pacified. The treatment is working. Once the prescribed 6 ounces have been collected in the bowl, the barber surgeon removes the tourniquet, and the flow of blood slows. He presses a clean linen pad, a bolus, over the small cut and binds your arm up tightly. The procedure is over. Venesection was the most common method of bloodletting, but it was not the only one. For more localized ailments, a physician might prescribe cupping and scarification. For this, the barber surgeon would take a series of small heated glass or ceramic cups and place them on the skin over the afflicted area. For instance, your back if you were suffering from lung congestion. As the air inside the heated cup cooled, it would create a powerful vacuum, sucking the skin up into the cup and drawing the blood to the surface. The surgeon would then remove the cup and use a special tool with multiple small blades to make a series of quick, superficial scratches on the raised skin. The cup would then be reapplied, and the vacuum would draw the bad blood out through the small cuts. And then there were the leeches. This practice, known as herodotherapy, involved one of nature's most perfect little bloodletting machines. The medicinal leech was the ideal tool for drawing blood from areas of the body that were too delicate or difficult to access with a lancet, such as on the face, near the eyes, on the tongue, or even inside the mouth or nose. The leech itself is a marvel of medical engineering. It has 3 sharp, serrated jaws that make a Y-shaped, relatively painless incision. As it bites, its saliva releases a complex cocktail of chemicals into your bloodstream. This includes a powerful anesthetic, which is why you barely feel the bite, and, most importantly, a potent anticoagulant called herodin. This substance prevents the blood from clotting, ensuring that it flows freely and continuously for as long as the leech is attached. A single leech can consume many times its own body weight in blood. Leeches were not just gathered randomly from ponds. They were a valuable medical commodity, and a thriving trade existed to supply them to physicians and apothecaries. There were professional leech collectors, or leech farmers, who would wade into ponds and allow the creatures to attach to their own legs, or to the legs of old horses, to be harvested. An apothecary would keep a large jar of them in his shop, a writhing, slimy collection of living pharmaceutical tools. It's fair to say that the modern fear of leeches would have been completely alien to you. You would have seen them as a useful and sophisticated medical instrument. It gives a whole new meaning to the idea of a pet that's good for your health. But was this strange and alarming procedure something that only the wealthy, who could afford a physician's consultation and a surgeon's fee, had to endure? Or was it a part of everyday life for everyone? This is a question that historians still debate. How deeply was the practice of bloodletting truly embedded in the social fabric of the medieval world? There is no doubt that a formal phlebotomy, prescribed with precision and performed with a specialized set of tools, was primarily a treatment for the affluent. However, the basic idea that removing blood was beneficial for your health was widespread across all levels of society. A common village barber, with less training than a city surgeon, might perform a simple bleeding for a peasant with a fever. A local wise woman, whose knowledge was based on folk tradition rather than learned texts, might use leeches to treat a swelling. The fundamental principle was part of the common understanding of how the body worked. Furthermore, bloodletting was not used only to treat existing illnesses. It was also widely practiced as a preventative measure a kind of seasonal health cleanse. Many people, and particularly monks living in monasteries, would undergo a prophylactic bleeding several times a year, most commonly in the spring and the autumn. The belief was that the changing of the seasons could disrupt the humors, and a preventative bleeding would help to keep them in balance, warding off sickness before it could ever take hold. The financial and infirmary records from medieval monasteries are filled with detailed accounts of these bleeding seasons, showing that it was a regular, scheduled part of their health regimen. Of course, for all its widespread acceptance and logical consistency within the humoral system, the practice of bloodletting was fraught with danger. The greatest risk of all was infection. The concept of sterilizing instruments was completely unknown. A barber surgeon might wipe his lancet on a cloth between patients, but that was the extent of the hygiene. The open wound, however small, was a gateway for bacteria, and a simple bloodletting could easily lead to a fatal case of sepsis. There was also the risk of error. A clumsy or inexperienced practitioner could accidentally sever an artery instead of a vein, leading to a catastrophic and uncontrollable hemorrhage. And there was always the danger of simply taking too much blood. A physician might misjudge the patient's constitution, or the barber surgeon might be careless in his measurements. For a person already weakened by a severe illness, a vigorous bloodletting that was meant to cure them could be the very thing that pushed their body over the edge into death. The famous case of George Washington, who died in 1799 after his doctors bled him of a huge quantity of blood to treat a throat infection, is a late and tragic example of the dangers of this long-enduring practice. But from the medieval perspective, if a patient died after being bled, it was not because the treatment was flawed. It was simply proof that the patient's humoral imbalance was too severe, that the disease was too strong. The theory itself was never called into question. As the barber surgeon packs up his tools, you notice the pole he keeps outside his shop. It is painted with a twisting spiral of red and white. This iconic symbol, which still adorns barbershops today, is a direct and visible legacy of his bloodletting trade. The pole itself represents the staff that a patient would grip tightly to make the veins in their arm bulge. The white of the spiral represents the clean linen bandages, and the red represents the blood-soaked bandages, which he would wash and then hang to dry, twisting in the wind on that same pole. The entire history of his bloody and vital profession is wrapped around that simple staff. You are now lying back on your mattress, your arm tightly bound. You feel weak, you feel dizzy, and you feel drained. But you are also told that these are good and hopeful signs. The corrupt, excessive humor that was poisoning your system has been purged. Your body, now cooled and calmed, can begin its slow and steady journey back to a state of perfect, healthy equilibrium. You have willingly, even gratefully, submitted to a procedure that, to our modern eyes, is terrifying, illogical, and counterintuitive. But to you, in your world, it is the very height of rational, scientific medicine. This direct, physical removal of the humors was the most dramatic and invasive form of treatment available. But your physician had other, less bloody ways of understanding the state of your internal fluid world. His most trusted and frequently used diagnostic tool required no knife and no leeches. It required only a glass flask, a keen eye, a discerning nose, and, on some truly unfortunate occasions, a very brave tongue. We now turn to the strange, complex, and colorful art of uroscopy. This direct physical removal of the humors was the most dramatic and invasive form of treatment available. But your physician had other, less bloody ways of understanding the state of your internal fluid world. His most trusted and frequently used diagnostic tool required no knife and no leeches. It required only a glass flask, a keen eye, a discerning nose, and, on some truly unfortunate occasions, a very brave tongue. Now that your blood has been let, your physician will confirm his diagnosis by examining the most intimate and revealing of your body's secretions. We now turn to the strange, complex, and colorful art of uroscopy. You have provided your doctor with a sample of your urine, collected that morning in a special glass flask. This flask is not just any old bottle. It is a purpose-built medical instrument known as a matula. It is made of clear, clean glass, so as not to distort the color of the contents, and its shape is significant. It has a round, bulbous bottom and a long, elegant neck, a shape that was believed to mimic the human bladder and urinary tract. Holding this flask was, in a symbolic sense, like holding the patient's own waterworks in your hand. You watch as the physician begins his analysis. For him, this flask is not a waste product to be disposed of. It is a crystal ball. It is a liquid message, a perfect distillate sent out from your four humors that can reveal the entire story of what is happening inside your body. The practice of uroscopy, or the diagnostic examination of urine, was not a minor or fringe part of medieval medicine. It was an absolute cornerstone, a sophisticated and highly respected science. The matula was the single most iconic symbol of the medical profession, as recognizable and essential to the medieval doctor as the stethoscope is to the modern one. The physician holds the matula up to the light, swirling it gently. His first and most important observation is of its color. To guide him in this, he would consult a urine wheel, a special diagram found in all the major medical textbooks of the day. This chart was a circular palette, depicting between 20 and 30 different possible colors of urine, each one meticulously labeled with its diagnostic meaning. This wheel provided a standardized scientific framework for interpretation. You can imagine him holding your flask, comparing its hue to the colors on his chart. The spectrum of possibilities is vast. A urine that is whitish, like whey or milk, might indicate a cold and wet phlegmatic imbalance or perhaps a problem with the head. A pale, straw-colored or citrine urine is the ideal, the color of perfect health and humoral balance. As the colors deepen, so do the problems. A golden or orange-yellow urine might suggest a choleric or hot and dry imbalance centered in the liver. A reddish or ruby-colored urine, like yours, points clearly to a sanguine or hot and moist condition in excess of the blood humor, just as he suspected. And at the end of the spectrum, a deep wine red, a greenish, or even a blackish urine is a dire and terrifying omen, a sign of a profound corruption or putrefaction of the humors that almost certainly portends a swift and imminent death. But the physician's analysis does not stop with a simple color check. A true master of uroscopy engaged all of his senses in the diagnostic process. After observing the color, he would unstopper the flask and conduct an olfactory examination. He would take a deep, thoughtful sniff of your sample. Did it have a pungent, foul aroma? This could indicate a dangerous internal heat, causing the humors to decay. Did it have a strangely sweet or fruity smell? This could point to a different kind of internal imbalance. The scent was another vital clue in the diagnostic puzzle. Next, he would assess its consistency or viscosity. He would give the matula a gentle swirl, watching how the liquid moved. Was it thin and watery, suggesting that the body's natural heat was too weak to properly cook the fluids? Or is it thick and syrupy, a sign that the humors were becoming dense and stagnant? He would also pay meticulous attention to any sediment, cloudiness, or suspended particles within the flask. These were known as the sedimentum. He would note their color, their texture. Was it flaky, sandy, or stringy? And most importantly, their position within the matula. This is because the flask, in his mind, was a perfect map of the human body. Any sediment floating at the very top of the liquid corresponded to an ailment in the head. Cloudiness in the middle of the flask pointed to a problem in the chest or abdomen, and particles that had settled at the very bottom, in the rounded part of the flask, indicated a disease of the bladder or the reproductive organs. It was a complete, if entirely imaginary, system of internal geography. And then comes the final, and to our minds, most unsettling, step in the examination. For certain conditions, a truly dedicated physician would confirm his diagnosis through taste. Now, he would not take a swig from the flask. The procedure was at least a little more dignified than that. He would dip the tip of his finger into the urine and then touch it to his tongue, much like a chef tasting a sauce for seasoning. The primary purpose of this alarming act of gustation was to check for one specific quality: sweetness. The condition that we now call diabetes was known to medieval physicians through the ancient texts as diabetes mellitus. The word diabetes refers to the excessive urination, and the Latin word mellitus means honey sweet. They knew that a key symptom of this particular disease was urine that tasted sweet. They had no concept of blood sugar or insulin, but they could diagnose this metabolic disorder with surprising accuracy through the simple, if deeply unpleasant, act of tasting their patient's urine. It certainly gives a new and powerful meaning to the old phrase, a bitter pill to swallow. For the medieval doctor, the patient's pill might be bitter, but the diagnosis could be unnervingly sweet. One can only assume that this was the least favorite part of any physician's job. But how much faith did the medical world and the public truly place in the diagnostic power of the macula alone? Was it always used as one tool among many, or did it sometimes become a kind of medical theater? This is a point on which historians still argue. Was the practice of uroscopy a legitimate diagnostic aid, or did it often degenerate into a form of fraudulent divination, a kind of uromancy? The serious university-trained physicians and the great medical textbooks they studied were clear on this point. Uroscopy was an important tool, but it was only one piece of a much larger puzzle. It was meant to be used in conjunction with a thorough examination of the patient's pulse, their breathing, their complexion, and a detailed interview about their lifestyle. Those 6 non-naturals of diet, sleep, exercise, and emotions. The urine was meant to confirm a diagnosis that was already being formed, not to be the sole source of that diagnosis. The great physicians warned sternly against doctors who would make pronouncements based only on a flask of urine without ever seeing the patient. However, the evidence is overwhelming that this is exactly what often happened. The image of the physician holding the macula up to the light was so powerful, so iconic, that it created a demand for a medical shortcut. Less scrupulous practitioners, or outright quacks, took full advantage of this. They would set up stalls in the marketplace and claim to be able to diagnose any disease, predict whether a patient would live or die, determine if a woman was pregnant, and even tell the sex of the unborn child, all from a single flask of urine brought to them by a servant or a family member. This practice of uromancy was a common subject of parody and complaint in medieval literature. There are countless satirical stories and poems about arrogant doctors making grand, sweeping, and entirely incorrect diagnoses based on a urine sample, only to be made to look like fools. The fact that this was such a popular topic for satire is a strong indication that it was a very real and widespread problem. Uroscopy, for many, had devolved from a scientific procedure into a kind of performance, a sideshow act where the doctor played the part of the all-knowing sage, using his glass flask not as a medical instrument, but as a theatrical prop, a crystal ball for impressing the gullible and extracting a fee. Of course, we now know the profound limitations of what a simple visual or sensory examination of urine can tell us. Yes, it can reveal a few key things. Very dark urine can indicate dehydration. The presence of blood can point to kidney disease or a bladder infection. And as we've seen, a sweet taste can accurately diagnose diabetes. But the elaborate and complex medieval system of linking 20 different colors and a dozen different types of sediment to the entire gamut of human diseases was almost entirely a work of fantasy. The color and consistency of urine are affected by countless benign factors, from the foods you've eaten to the amount of water you've had to drink. The intricate diagnostic charts and the geographical mapping of the flask were a testament not to medical reality, but to the human mind's incredible capacity for creating complex, logical, and internally consistent systems that bear no resemblance to the truth. Your physician now completes his examination. He has held your macula to the light, studied its reddish hue against his urine wheel, noted its consistency and aroma, and perhaps, if he was feeling particularly thorough, had a tiny judicious taste. He now lowers the flask and looks at you with an expression of absolute, unwavering confidence. The uroscopy, he declares, has confirmed his initial diagnosis. The reddish color is a clear and unmistakable sign of a surplus of the blood humor. Therefore, the treatment he has already prescribed, the bloodletting you just endured, is absolutely the correct and scientific course of action. You, the patient, feel a wave of relief. This strange and intimate ritual has provided what you believe to be scientific proof of your ailment. It has validated the treatment, and it has confirmed that your doctor is a master of his craft, able to read the secret messages of your body. This deep dive into the body's outputs was a cornerstone of internal diagnosis. But to understand and treat the body's external problems, the violent injuries of accident and war, the surgeon relied on a much more graphic and terrifying kind of chart, a single, bloody, and unforgettable image that served as a brutal catalog of all the violent things that could possibly happen to a human body. We turn now to the grim and fascinating illustration known as the Wound Man. You are lying back on your mattress, your arm tightly bandaged. You feel weak, dizzy, and drained, but you are also told that these are good and hopeful signs. The excess humor has been purged. Your body can now begin its journey back to equilibrium. You have willingly submitted to a procedure that, to our eyes, is terrifying and counterintuitive. But to you, it is the height of rational, scientific medicine. This direct removal of the humors was the most dramatic form of treatment, but your physician had other, less invasive, ways of understanding the state of your internal fluids. His most trusted diagnostic tool required no knife at all. It was a flask, a keen eye, a discerning nose, and on occasion a brave tongue. We now turn to the bizarre and complex art of uroscopy. But your physician, with his abstract theories and his clean hands, deals with the invisible internal world of humoral imbalance. What happens when the problem is not an invisible imbalance, but a very visible, external, and violent injury? For this, you must turn from the physician to the surgeon, and his world is not one of subtle diagnosis, but of blood, bone, and steel. And to navigate this world, he relied on a diagram as gruesome, as direct, and as unforgettable as the injuries he treated. We turn now to the grim and fascinating illustration known as the Wound Man. Imagine you are an apprentice to a barber surgeon, learning the craft. Your master opens a heavy, handwritten surgical textbook, and on the page you see an image that stops your breath. It is a single standing male figure. He is naked, save for a small loincloth, and he is looking out at you with a strangely placid, almost bored expression on his face. This calm is what makes the rest of the image so deeply shocking. His body is a complete and utter catalog of catastrophe. He is a living diagram of every possible traumatic injury that a person could suffer in the violent medieval world. He is not a patient, he is not a victim, he is a map. He is a bloody, breathing, and bleeding table of contents for the surgical manual he inhabits. His purpose is to show, in one single, comprehensive image, all the violent possibilities that a surgeon might have to face. Let us take a tour of this unfortunate figure, this poster child for having a very, very bad day. His body is a forest of embedded weaponry. From the top of his head, a dagger pierces his skull. On one side of his head, a cudgel, a simple peasant's club, is shown making a brutal impact. In his shoulder, a great battle axe is lodged deep into the bone. His chest and torso are a pincushion of military hardware. A long spear has been thrust through his side, its tip emerging from his back. A broadsword has slashed open his chest. An arrow with a barbed head is buried deep in his abdomen, while a crossbow bolt has penetrated his stomach. His limbs are no better off. One arm is shown with a deep cut from a knife, while his leg has a compound fracture, the bone clearly shattered. But what makes the wound man so fascinating is that he is not just a victim of battlefield violence. He is a victim of every possible misadventure that could befall a person. And so, alongside the epic wounds of war, you see the mundane and miscellaneous injuries of everyday life. On his calf, a snarling dog is shown biting his leg, a clear reference to the ever-present danger of animal attacks and rabies. On his ankle, a venomous snake, perhaps an adder, is sinking its fangs into his flesh. A swarm of bees or wasps is shown stinging his hand. Elsewhere on his body, you might see a festering boil or a blister depicted on his thigh. He has been stabbed, clubbed, slashed, pierced, bitten, and stung. He is a complete encyclopedic representation of physical suffering. So, what was the practical purpose of this gruesome and overwhelming image? The Wound Man was, in essence, an incredibly innovative and practical quick reference guide. In an age before page numbers were standardized and before alphabetized indexes were common, finding the information you needed in a dense, handwritten textbook could be a slow and difficult process. The Wound Man solved this problem visually. Each of the 24 or more injuries depicted on his body would have a number next to it, or a thin line drawn from the wound to a piece of text in the margin of the page. This text would then direct the surgeon to the precise chapter or paragraph in the book that dealt with that specific injury. So, if a patient is brought to you, bleeding from a deep spear wound to the side, you, the surgeon, do not have to frantically flip through the entire manual. You simply look at the Wound Man diagram, find the spear in his side, follow the corresponding line or number, and it will guide you immediately to the correct page. There, you will find the instructions you need. How to safely extract the spearhead, what herbs to use in a poultice to prevent putrefaction, what prayers should be said to ensure the patient's recovery, and how to stitch the wound closed. It was the medieval equivalent of a hyperlink, a QR code printed in blood and ink, a brutal but brilliant way of organizing and accessing vital, life-saving information in a high-stress environment. But was the Wound Man just a practical, if grisly, surgical flowchart? Or did this unforgettable image hold a deeper, more symbolic meaning for the people who created and viewed it? This is a question that historians and art historians still argue about. Was he a tool, or was he an icon? The argument for him being a purely practical tool is straightforward. Surgery was a messy, pragmatic business. The Wound Man was an ingenious mnemonic device, a way to structure a textbook and make its contents accessible. His strangely calm, passive expression is simply a reflection of the fact that he is not meant to be a real suffering person. He is a neutral, anatomical diagram, an abstract representation of injuries, not a depiction of a man in agony. He is no more a real person than a modern CPR dummy is. Other historians, however, see a much deeper layer of religious and cultural meaning in the image. They argue that the Wound Man was also a powerful symbol. He could be seen as a kind of surgical memento mori, a graphic and constant reminder of the fragility of the human body and the countless dangers that surrounded it. He is a representation of the fallen, suffering state of all humanity since the expulsion of Adam and Eve from the Garden of Eden. In this view, his calm expression is not one of abstract neutrality, but of pious, Christ-like resignation. Like Jesus, he passively endures all the wounds of the world upon his own body. He is a figure of suffering, but also of stoic endurance. He is not just a table of contents. He is a focus for meditation on the nature of pain and the human condition. The treatments that the Wound Man pointed towards were a mixture of the practical, the herbal, and the magical. For an embedded arrowhead, The manual might give instructions on how to use a specialized tool, a kind of scoop, to carefully extract the head. Or, if the arrow was bobbed, it might give the terrifying advice to push the arrow all the way through the limb to be pulled out the other side, to avoid the greater damage of pulling the barb back through the flesh. The text would then instruct you to clean the wound, not with water, but with wine, whose alcohol content made it a surprisingly effective, if painful, disinfectant. You would be instructed on how to stitch the wound closed using a fine needle and a thread made of silk, or sometimes even human hair. You would be given recipes for poultices to place on the wound, often containing herbs like comfrey, which was believed to help knit bones and tissues back together, or yarrow, to control bleeding. And for the most severe wounds, especially those that had become infected, the surgeon had one final terrifying tool at his disposal: cauterization. This involved heating a piece of iron in a fire until it was glowing red hot, and then pressing it directly into the wound. The goal was to burn away the dead or putrefied tissue and to seal the blood vessels to stop bleeding. It was an act of extreme agonizing violence, but in a world without antibiotics, this brutal, sterilizing fire was sometimes the only way to stop a rampant infection from spreading and killing the patient. It is fascinating to place the image of the wound man alongside the image of the urine wheel, which we explored in the last section. Together, they form a perfect diptych of the two great branches of medieval medicine. The urine wheel, the symbol of the physician, is clean, abstract, symmetrical, and theoretical. It depicts the body's internal, invisible, humoral landscape. The wound man, the symbol of the surgeon, is bloody, chaotic, violent, and symmetrical. It depicts the body's external, physical, and traumatic reality. One is a map of the fluids within, the other is a map of the damage without. The physician was the master of the urine wheel, a philosopher of internal medicine. The barber surgeon was the master of the wound man, a craftsman of external repair. You close the heavy cover of the surgical manual, but the image of the stoic, catastrophically injured man is burned into your mind. This single, gruesome diagram tells you everything you need to know about the pervasive violence and the countless dangers of the medieval world. It is a map of pain, a catalogue of all the ways that a body can be broken, torn, and pierced. And it is a testament to the practical, bloody, and often desperate art of the surgeon who had to try and mend it. But the wound man only shows injuries inflicted from the outside by a sword, a dog, or a snake. What about those afflictions of the mind, the fits of madness, or the crushing despair of melancholy, that were believed to be caused not by an external weapon, but by a pressure from within? What about an evil spirit or a bad humor trapped inside the skull, pressing on the brain? For that, the surgeon required a different, and perhaps even more terrifying tool, and a far more radical procedure. We must now turn to the ancient and unnerving practice of trepanation. The wound man is a map of pain, a catalogue of all the ways that a body can be broken, torn, and pierced by the violent external world. And it is a testament to the practical, bloody, and often desperate art of the surgeon who had to try and mend it. But the wound man only shows injuries inflicted from the outside by a sword, a dog, or a snake. What about those afflictions of the mind, the fits of madness, or the crushing despair of melancholy, that were believed to be caused not by an external weapon, but by a pressure building from within? What about an evil spirit or a bad humor trapped inside the skull, pressing on the very seat of reason? For that, the surgeon required a different, and perhaps even more terrifying, tool and a far more radical and invasive procedure. We must now turn to the ancient and unnerving practice of trepanation. Imagine now that you are not suffering from a visible wound, but from an invisible torment. Perhaps it is you or a member of your family. The ailment could be persistent, debilitating headaches that leave you blind with pain for days on end. It could be epilepsy, a condition that causes you to fall to the ground, your body racked with violent, uncontrollable convulsion. Or it could be a profound and unshakable melancholy, a deep, dark depression that drains the world of all color and joy, leaving you in a state of living death. You seek help. The local priest may be summoned, and seeing you in the throes of a seizure, he may declare that you are possessed by a demon, an evil spirit that has taken up residence inside your body and is hijacking your limbs. The university-trained physician, after examining your urine and consulting his charts, might offer a different, though related, diagnosis. He may conclude that your melancholy is caused by a dangerous excess of black bile, the cold, dry humor, which has become corrupted and is producing a foul vapor, a black fume that is rising and getting trapped inside your skull, pressing on your skull, brain, and extinguishing the light of your reason. The spiritual diagnosis and the medical diagnosis are different, but they point to the same terrifying mechanical problem. Whether it is a demon or a humor, the cause of your suffering is something that is trapped inside your head and needs to be let out. Your skull, the very fortress of your soul, has become a prison, and the only cure is to create an exit. This is where the barber surgeon is called upon once more, for a procedure that is so extreme, so invasive, it is difficult for a modern mind to even comprehend. It is one of the oldest surgical procedures in all of human history, with skulls showing evidence of it dating back to the Neolithic period, thousands of years before your time. It is called trepanning, or trepanation, and it involves deliberately, carefully, and consciously cutting a hole in a living person's skull. You are now faced with a truly awful choice: to continue to endure the hell of your current condition, or to submit to an operation that could very easily kill you, but which promises the only hope of release. You make your decision. The surgeon arrives with his specialized tools, which look as though they belong more to a carpenter or a torturer than to a healer. There is no anesthetic, save for perhaps a strong dose of wine to dull your senses, or a sponge soaked in a soporific mixture of opium, mandrake, and henbane, a dangerous and unreliable concoction that could easily prove fatal on its own. You are held down firmly by several strong assistants. The surgeon takes a sharp knife and makes a deep incision in your scalp, peeling the skin and flesh back to expose the pale, white bone of your skull. Then the main tool is produced. It is called a trepan, and it is essentially a hand-cranked drill. It has a handle that the surgeon turns, which rotates a cylindrical, saw-toothed blade at the other end. In the center of the blade is a sharp point, which is placed on the desired spot on your skull to hold the drill in place. The surgeon begins to turn the crank. You hear the sound, a slow, grating, crunching sound, the sound of metal teeth biting into your own living bone. You feel the pressure, the vibration rattling through your entire head. The surgeon must proceed with immense skill and caution. His goal is to cut through the thick bone of the skull without piercing the delicate membrane beneath, the dura mater, which protects the brain itself. A slip of the hand, a moment of too much pressure, would mean a fatal injury. For agonizing minute after agonizing minute, the surgeon drills and scrapes, carefully blowing the bone dust away, checking the depth of his cut. Finally, with a soft crack, the circular piece of bone, the roundel, comes loose. The surgeon uses a special tool called an elevator to carefully pry the plug of bone out of your skull. And now there is a hole, a perfect, round window into your cranium. The procedure is complete. In that moment, a great sense of theater might take over. The surgeon or the priest might declare for all to hear that the evil spirit has now been released, that the corrupt, melancholic vapor has been vented. The pressure is gone. The hole in your head has allowed the source of your torment to escape into the air. The piece of bone that was removed might be seen as a powerful magical object, a relic from your ordeal. It might be shaped, polished, and given back to you to be worn as an amulet around your neck, a potent charm to prevent the evil from ever returning. Sometimes the hole in the skull would be left open, covered only by the flap of scalp that was stitched back into place. The most astonishing part of this entire terrifying ordeal is that people could and did survive it. This is not speculation. It is an archaeological certainty. Skulls bearing the unmistakable marks of trepanation have been found all over the world, from the Stone Age to the Middle Ages, and many of these skulls show clear, unambiguous signs of healing. The edges of the hole in the bone are smooth and rounded, a sign of new bone growth. This means that the person did not die on the operating table, or even weeks later from infection. They lived for months, and in many cases for years after having a hole drilled in their head. This is a silent, bony testament to the incredible skill of some of these early surgeons, and to the almost unbelievable resilience of the human body. But what was the surgeon really trying to accomplish with this brutal act of cranial intrusion? Was it, at its heart, a rational, if flawed, medical procedure? Or was it a profoundly magical, spiritual ritual? This is a question that historians and archaeologists still argue about. The argument for it being a rational medical procedure is strong. In cases of a physical head injury, like a skull fracture from a blow in battle, trepanation could have been a life-saving intervention. It could relieve the intracranial pressure caused by swelling or internal bleeding, something that modern neurosurgeons still do today, albeit with far more sophisticated tools and understanding. And within the logic of the humoral theory, drilling a hole to release the foul vapors of black bile that were causing melancholy or madness was a perfectly sensible, if extreme, therapeutic act. The goal in this view was physical and medical. The other view, however, is that the procedure was primarily magical and ritualistic in nature. The hole was not meant to release a physical substance like blood or humor, but a metaphysical one, a demon, a ghost, an evil spirit that had possessed the individual. The operation was, in essence, a violent exorcism, performed with a drill instead of a holy book. The surgeon was not acting as a physician, but as a shaman, a witch doctor, physically opening a gateway for the supernatural entity to escape. As with so many things in the medieval world, the line between what was considered medicine and what was considered magic was incredibly thin, if it existed at all. The surgeon who drilled a hole in your head to release the corrupt humor of black bile probably also believed he was providing an escape route for a malevolent spirit. The physical and the spiritual causes of your illness were seen as two sides of the same coin, and trepanation was a procedure that addressed both at the same time. You awaken from the ordeal. Perhaps you were given a soporific sponge and have been unconscious. Or perhaps you have been awake the entire time and are only now emerging from a state of shock and terror. A blinding, throbbing headache is a small price to pay for having survived such a procedure. You have a hole in your head, a permanent man-made opening in the fortress of your skull. It is a testament to the depths of the suffering you endured, and to the extreme, almost unthinkable, measures your civilization would employ in its desperate search for a cure. This brutal direct intervention, this attempt to physically alter the very structure of the body to restore its health, was a high-risk, high-stakes gamble. But even the simplest medical act, such as prescribing a dose of herbs or choosing the right day for a bleeding, was not left to chance or to the physician's judgment alone. The success or failure of any treatment, indeed, the very health of your body, was believed to be governed by forces far more powerful and far more distant, the silent, inexorable movements of the planets and the stars. To understand medieval medicine, you must now turn your gaze from the body to the sky and explore the strange and beautiful world of medical astrology. This brutal intervention, this attempt to physically alter the very structure of the body to restore balance, was a high-risk gamble. But even the simplest medical act, like taking a dose of herbs or choosing the right day for a bleeding, was governed by forces far beyond your own body. The success or failure of any treatment depended not just on the skill of the physician, but on the alignment of the planets and the position of the moon in the heavens. To understand medieval medicine, you must now turn your gaze from the bloody surgical manual on the table to the vast, silent, and all-powerful sky above. You must enter the beautiful and deeply bizarre world of medical astrology. The foundational principle of this science is as simple as it is profound. Us above, so below. You, the individual human being, are a microcosm, a tiny, perfect reflection of the great macrocosm of the heavens. The movements of the celestial bodies, the sun, the moon, and the 5 known planets of your time are not distant, unrelated events. They exert a direct physical and continuous influence on the world below, affecting the tides, the weather, the growth of crops, and most importantly, the delicate balance of the 4 humors within your own body. For a medieval physician, medicine and astrology were not 2 separate disciplines. They were 2 sides of the same coin. A doctor who could not read the stars was considered to be flying blind. Astrology was not a fringe superstition or a folk belief. It was a required core component of the curriculum at every major medical university in Europe, from Bologna and Padua in Italy to Paris and Oxford. A physician's training involved years of studying the complex mathematics and intricate theories of Ptolemaic astronomy. When you called for a doctor, you expected him to be a competent astrologer. One of his first tasks upon diagnosing your illness would be to cast your horoscope, painstakingly calculating the exact position of the planets at the moment of your birth to understand your innate humoral complexion. He would then calculate a second chart for the moment you fell ill to understand the celestial influences that had triggered your current crisis. To do this, he would carry a set of essential tools. He would have an ephemeris, a book of complex tables that listed the precise celestial positions for every day of the year. He might also have a beautiful and ingenious device called a volvel, a kind of medieval slide rule made of layered, rotating paper or parchment circles, which helped him make his complex calculations more quickly. But his most important and frequently used astrological guide was a single, iconic diagram, an image as central to his art as the wound man was to the surgeons. This was the Homo Signorum, the zodiac man. Imagine this illustration in a medical textbook. It shows a human figure standing with his arms outstretched, and all around him are the 12 signs of the zodiac, with thin lines drawn from each sign to the specific part of the human body that it was believed to govern or rule. A rule? This was a celestial map of your own anatomy. The correspondences were specific and universally accepted. The zodiac begins with Aries, the ram, which you can see at the top of the diagram, ruling over the head. Next is Taurus, the bull, which governs the neck and the throat. Gemini, the twins, corresponds to the arms, hands, and shoulders. Cancer, the crab, rules over the chest, breasts, and lungs. Leo, the lion, holds dominion over the heart, stomach, and spine. Virgo, the virgin, governs the abdomen and the intestines. Moving down the body, Libra, the scales, rules the loins and the kidneys. Scorpio, the scorpion, a sign of great power and danger, governs the groin and the reproductive organs. Sagittarius, the archer, rules the hips and the thighs. Capricorn, the goat, is the lord of the knees. Aquarius, the water-bearer, governs the calves and the ankles. And finally, the zodiac ends at the bottom of the body with Pisces, the fish, which rules over the feet. This was not just a piece of symbolic art. It was a practical and absolutely critical guide for all medical interventions. The single most important rule in all of medical astrology, a rule that no physician or surgeon would dare to ignore, was this: you must never, ever cut into or otherwise treat a part of the body when the moon is currently passing through the zodiac. Sign that rules it. Let's return to your case. You have a fever, and your physician has prescribed a bloodletting from your arm to relieve your excess of hot, sanguine blood. Before the barber surgeon can be summoned with his lancet, your physician must first consult his ephemeris and his astrolabe. He must calculate the current position of the moon in the sky. If he finds that the moon is, at that moment, passing through the constellation of Gemini, the sign that rules the arms, the procedure must be immediately and unconditionally postponed. To cut into your arm while it is under the direct potent influence of the moon would be to invite disaster. The moon's power would make that part of your body unstable and vulnerable. The bleeding might become uncontrollable. The wound might refuse to heal, becoming infected and gangrenous. It would be an act of extreme medical malpractice. You would have to wait for a few days until the moon had moved on into Cancer before the bleeding could be performed safely. It's a bit like having to reschedule your surgery because your astrological forecast for the day is cloudy with a chance of disaster. This rule applied to every medical procedure. If you were suffering from debilitating headaches and required a trepanation, the surgeon would be forbidden from drilling into your skull during the time when the moon was in Aries, the sign of the head. To do so would be to risk almost certain death. Every single treatment was timed according to this celestial calendar. The next layer of complexity involved the planets themselves. Each of the 7 celestial bodies known to youth Sun, the Moon, Mercury, Venus, Mars, Jupiter, and Saturn was also believed to have a fundamental humoral quality. Mars, the red planet, was naturally hot and dry, and therefore had a choleric influence. The moon, with its connection to the tides, was cold and moist, and thus phlegmatic. Jupiter, the great benevolent planet, was hot and moist, a sanguine influence. And Saturn, the distant, slow-moving planet, was cold and dry, and strongly associated with the humor of black bile, or melancholy. The physician would analyze the position of these planets at the time of your birth and at the onset of your illness to understand the cosmic forces at play. If he saw that the planet Mars was in a particularly powerful position in your astrological chart, it would help to explain why you had a naturally choleric or angry temperament. If Venus, a warm and moist planet, was ascendant when you fell ill, it might point to a disease caused by an excess of pleasure or indulgence. The doctor was not just diagnosing your body. He was diagnosing your body's relationship with the entire cosmos. But how did this complex and seemingly fatalistic system, where your health and personality were literally written in the stars, coexist with the core tenets of Christianity? If your life was governed by the movements of the planets, where was the room for an all-powerful God? And where was the room for your own free will to choose between good and evil? This was a major and delicate intellectual problem for the medieval world, and historians still argue about how successfully the thinkers of the time reconciled these two powerful belief systems. To a hardline theologian, astrology could look dangerously like a pagan heresy. It seemed to deny the power of God and to suggest that human life was predetermined, a belief that the church strongly condemned. To get around this, the learned physicians and philosophers of the age developed a sophisticated compromise. Their guiding principle was a Latin phrase, astra inclinant, non necessitant. This means, the stars incline, they do not compel. This elegant phrase solved the problem. It meant that the planets and the stars could exert a powerful influence on your body and your personality. They could create tendencies, inclinations, or predisposition, but they could not force you to act. Your God-given reason and your immortal soul were stronger than any celestial influence. For example, the powerful position of Mars in your chart might make you naturally inclined to anger and violence. But you, as a good Christian, could use your free will to recognize this tendency and choose to be patient and forgiving. Astrology, therefore, was not a tool for predicting an unchangeable future. It was a diagnostic tool for understanding your innate humoral weaknesses, so that you could be better equipped to guard against them both physically and morally. Let's put it all together in a hypothetical case. Imagine you are suffering from a persistent phlegmy cough. You go to your physician. He will first diagnose the problem in humoral terms. You have an excess of the cold, moist humor, phlegm, centered in your chest, which is ruled by the sign of Cancer. Next, he will look at your astrological chart. He might note that you fell ill when the moon, a cold and more moist planet, was in a particularly powerful position, explaining the celestial trigger for your condition. Now he must devise a treatment. Following the doctrine of opposites, he will prescribe a remedy that is hot and dry. This might be a special diet, avoiding all cold foods, or it might be an herbal medicine, perhaps a tea brewed with hot spices like ginger, cloves, and pepper. But the final and most crucial part of the prescription is the timing. When should you take this medicine for it to be most effective? The physician will consult his tables once again. He must find a day and an hour when the celestial influences are favorable. He will look for a time when the power of the cold, moist moon is weak, and when a helpful, hot, and dry planet like Mars is in a strong, dominant position in the heavens. He will then give you your prescription, which will include not just the ingredients for the herbal tea, but the precise day and hour on which you must drink it. To take the medicine at the wrong astrological time would be to render it useless or even harmful. A modern patient gets a bottle of pills with the instruction take twice a day with meals. You get a bag of herbs with the instruction boil in water and drink next Tuesday at 3:15 in the afternoon. You receive your complex prescription from the physician. It is not just a list of ingredients. It is a set of instructions that places your small suffering body in the context of the grand cosmic dance of the heavens. This belief in the power of the stars was not a fringe superstition practiced by village fortune tellers. It was the absolute height of learned scientific medicine, a complex and intellectually dazzling system that layered the immutable laws of the cosmos on top of the fragile humors of your body. But even when the stars were perfectly aligned and the diagnosis was considered certain, the actual physical remedies prescribed by the doctor were often drawn from a very strange and earthly pharmacy. They were cures derived from a world of fur, feather, and fang, the world of animal remedies. Your personal health is inextricably linked to the grand cosmic dance of the heavens. This belief in the power of the stars was not a fringe superstition. It was the height of scientific medicine, a complex and intellectually dazzling system that layered the cosmos on top of your body. But even when the stars were perfectly aligned and the timing of your treatment was deemed auspicious, the actual physical remedies prescribed by your physician were often drawn from a very strange and earthly pharmacy. With the celestial conditions just right, you would now be given your medicine, a concoction derived not from a laboratory, but from a world of fur, feather, and fang. We must now explore the medieval bestiary of bizarre cures. The use of animals and their byproducts in medicine, a practice sometimes called zootherapy, was a fundamental part of your world. This was not just folk magic practiced by village healers. It was a core component of learned academic medicine. The great medical textbooks written by respected physicians and abbesses were filled with hundreds of recipes that relied on animal parts. The logic behind these treatments was a fascinating blend of humoral theory and a more ancient intuitive belief system known as sympathetic magic. First, just like the planets and the plants, every animal was believed to possess a core humoral quality. A lion, with its ferocious and fiery nature, was obviously a hot and dry animal. A fish living in the water was just as obviously cold and moist. Therefore, a remedy made from a lion's heart would be used to treat a cold condition, while a fish-based remedy might be used to cool a fever. The animal's essence was a direct reflection of its humoral nature. Second, and perhaps more importantly, was the idea of sympathetic magic. This was the belief that like affects like, and that the inherent qualities of an animal could be magically transferred to you the patient by consuming or applying a part of its body. If you were suffering from a breathing ailment, a physician might prescribe a concoction containing the dried and powdered lungs of a fox, because foxes were known for their incredible stamina and lung capacity. By consuming the fox's lungs, you were believed to be absorbing their strength into your own weakened chest. If you were timid or cowardly, you might be given the heart of a lion to eat to magically grant you its courage. This was a direct, visceral, and powerful form of medicine. Let us take a tour through this strange and sometimes stomach-turning pharmacy. We can begin with the familiar animals of the farm, whose medicinal uses were extensive. You already know that chicken soup is considered a restorative for someone suffering from a cold. This belief is ancient. The unmoist quality of the chicken, when boiled into a broth, was seen as the perfect gentle remedy to counteract the cold and moist imbalance of a phlegmatic illness. From your sheep you would get not just meat and wool, but also lanolin. The greasy, fatty substance found in a sheep's wool was a prized base for all manner of ointments and salves, valued for its ability to soothe and protect the skin. Animal fat in general was a crucial medical ingredient. The rendered fat of a goose, a bear, or even a badger was considered a potent warming agent. If you were suffering from aches in your joints, what we might call arthritis, which was seen as a cold condition, your physician would prescribe a vigorous rubbing with one of these fats. The heat generated by the rubbing, combined with the innate hot quality of the fat itself, was believed to penetrate the joint and drive out the cold humors that were causing the pain. From the farm, we can move into the wilder world of the forest and the field, where the remedies become stranger. The humble earthworm, for instance, was a medical powerhouse. If you were suffering from a fever, you might be given a potion containing dried, powdered earthworms. They were also a common treatment for bladder stones, based on the idea that their ability to burrow through the earth could be magically transferred to help the stone burrow its way out of your body. If you had a skin condition like a burn or a rash, your healer might turn to the snail. A common treatment involved allowing live snails to crawl over the afflicted area. Their slime, which we now know is incredibly hydrating and contains beneficial compounds, was believed to be a miraculously soothing and healing balm. Alternatively, the slime would be carefully collected and mixed into an ointment. It was surely the world's slowest, but perhaps one of its more effective dermatological treatments. And as we have seen in other contexts, the common spider's web was a universal tool in any first aid kit. A thick mat of cobwebs pressed into a bleeding cut was known to be one of the best ways to stanch the flow of blood, the fine threads creating a natural scaffold for a clot to form. As we move deeper into the bestiary, the remedies become more specific and more bizarre. The rendered fat of young puppies was considered a particularly fine and gentle type of grease, highly prized as a base for ointments used on very delicate skin or for treating sensitive wounds. If you were suffering from vision problems, a healer might recommend a truly strange cure involving swallows. It was believed that mother swallows kept special magical stones in their nests, and that if these stones were retrieved and gently touched to a person's eyes, they could restore failing sight. The toad was another creature of great medical and magical power. In a time of plague, you might see people wearing a strange amulet around their necks, a small dried toad in a silk bag. Based on the principles of sympathetic magic, it was believed that the toad, a creature that lived in damp, dark places and was seen as naturally poisonous, would attract the poison of the plague from the air, drawing it into its own dried body, and thus protecting the wearer. It was a kind of spiritual and biological lightning rod for the pestilence. So were these strange concoctions just superstitious nonsense, a collection of old wives' tales? Or was there a genuine, if limited, medical effect to be found in this animal pharmacy? This is a question that historians and pharmacologists still argue about. Where is the line between folk magic and a kind of proto-pharmacology? Certainly, many of these remedies were based on pure magical thinking. The idea that eating a hare's heart could cure timidity, or that wearing a dried toad could ward off a bacterial infection. is clearly in the realm of superstition. The logic was based on symbols, not on science. However, it would be a mistake to dismiss all of these treatments as useless. Many of them were based on generations of careful, if informal, observation. The use of lanolin as a moisturizer, for instance, is perfectly sound. The application of animal fat as a warming rub, or rubefacient, genuinely does increase blood flow to a sore muscle and create a feeling of relief, even if the reason has nothing to do with humors. The use of honey on a wound, an animal product from the bee, is now recognized as a powerful antiseptic. Biological practitioner was observing real, small-scale, positive effects. Their explanation for why a treatment worked might have been completely wrong, based on a flawed understanding of the cosmos, but their observation that it did work, at least sometimes, was often correct. They were practicing a kind of accidental science, but of all the animal-based remedies in the medieval pharmacopoeia, one stands out as the most bizarre, the most prized, and the most disturbing of all. This was the ultimate cure-all, a substance imported at great cost from a distant ancient land and prescribed for an astonishing range of ailments. This was mummia, or as it is more commonly known, mummy powder. You are suffering from a persistent headache or perhaps a bruising from a fall. Your apothecary recommends the most powerful medicine he has. He brings out a small heavy stone jar, and from it he takes a spoonful of a dark, blackish-brown and pungent-smelling powder. He tells you that this is genuine mummia from Alexandria, and he is telling you the truth. The powder he is about to mix into a cup of wine for you is, in fact, the ground-up physical remains of an ancient Egyptian. For centuries, a vast and lucrative trade existed, shipping the mummified bodies of ancient pharaohs, nobles, and even commoners from the tombs of Egypt to the apothecary shops of Europe. It was believed that the bitumen and resins used in the mummification process were powerful medicines. More than that, it was believed that the mummified body itself, the vessel of a soul that had been preserved for thousands of years, contained a potent and magical life force. To consume this powder was to consume a piece of that ancient magic and vitality. Mummia was prescribed for everything. It was taken internally for headaches, stomach pains, coughs, and as a general preventative against disease. It was mixed into plasters and applied externally to bruises, wounds, and broken bones. It was considered one of the most powerful and versatile drugs in the world, a true panacea. It gives a whole new, and very literal, meaning to the idea of a body of knowledge. Of course, with such high demand for a rare and expensive product, the trade was rife with fraud. The supply of genuine ancient mummies, while large, was not infinite. Unscrupulous merchants would create counterfeit mummia dye. They would take the bodies of recently executed criminals, or the unclaimed bodies of the poor, and use a crude process to dry them out, sometimes treating them with bitumen to mimic the ancient appearance. They would then grind these modern bodies up and pass them off as genuine 3,000-year-old Egyptian mummy powder. The line between medicine and cannibalism became horrifyingly thin. So you are now presented with your prescription. It is a cup of dark, spiced wine, made even darker by the spoonful of black, gritty, and pungently aromatic powder that has been stirred into it. You are told that this is the finest Egyptian mummia, a potent remedy that will balance your humors and restore your health. You hold your breath, you trust in the ancient magic and the physician's science, and you drink it down. The medieval pharmacy was a weird and wonderful place, a treasure chest of remedies drawn from every corner of the animal kingdom. Its logic was a complex tapestry, woven from threads of humoral theory, sympathetic magic, careful observation, and deep-seated superstition. But the animal kingdom, for all its strange offerings, was only one wing of this great pharmacy. An even larger, more complex, and more immediately accessible world of cures grew directly from the earth itself, in the leaves, the roots, the flowers, and the seeds of the world's plants. And then, as you will see, this garden of remedies was also a garden of great and terrible dangers. The medieval pharmacy was a weird and wonderful place. A treasure chest of remedies drawn from every corner of the animal kingdom. Its logic was a complex tapestry, woven from threads of humoral theory, sympathetic magic, careful observation, and deep-seated superstition. But the animal kingdom, for all its strange and sometimes stomach-turning offerings, was only one wing of this great pharmacy. An even larger, more complex and more immediately accessible world of cures grew directly from the earth itself. In the leaves, the roots, the flowers, and the seeds of the world's plants. And as you will see, this healing garden was also a garden of great and terrible dangers. Herbalism was the true foundation of all pharmacology, from the university-trained physician's complex prescriptions to the simple remedies of a village-wise woman. The primary source of medicine for any community was its garden. In a monastery, you would find a meticulously organized hortus medicus, a physic garden with neat beds of carefully cultivated medicinal plants from all over the known world. In a village, the local healer's knowledge would be centered on the plants that grew wild in the surrounding hedgerows, meadows, and woodlands. This was a living pharmacy, and its use was governed by the same humoral principles that dictated all of medicine. Every plant, just like every animal and every planet, was believed to possess a fundamental humoral quality. A plant that tasted cool and moist like a violet or a water lily was classified as cold and would be used to treat hot conditions like fevers, inflammations, or skin rashes. You might be given a syrup of violets to soothe a hot, angry cough, or a plaster of crushed rose petals to cool an inflamed wound. Conversely, a plant that tasted pungent and fiery, like mustard, ginger, or pepper, was classified as hot and dry. These would be used to treat cold ailments. A warming plaster of mustard seed might be placed on the chest to break up the cold, moist phlegm of a lung infection. A tea brewed with hot, dry spices would be prescribed to stimulate a sluggish, cold digestion. The logic was always to apply the opposite quality to restore the body's natural balance. Many of the plants in this garden were genuinely beneficial, and their use was based on centuries, if not millennia, of careful observation. A medieval herbalist had a surprisingly effective toolkit for treating common ailments. If you came to him with a fever and a headache, he might give you a tea brewed from the bark of the willow tree. He had no idea that it contained a chemical called salicin, the natural precursor to modern aspirin. But he knew from generations of experience that it brought down fevers and eased pain. If you had a badly broken leg, the surgeon might set the bone, but the herbalist would provide a poultice made from the crushed leaves and roots of the comfrey plant. This plant was so well known for its ability to help heal fractures that its common name was knit bone. If you had a bleeding wound, you might have it packed with the feathery leaves of yarrow, a plant whose reputation for staunching blood was so well known that its other common name was Untold. One of the most remarkable examples of this accidental pharmacology was the use of the foxglove plant. A physician might see a patient suffering from what was called dropsy condition, where the body swells with fluid, leaving the patient weak and breathless. We now know this is a symptom of congestive heart failure. The medieval doctor would prescribe carefully prepared doses of foxglove, which often had the seemingly miraculous effect of strengthening the heartbeat and helping the body expel the excess fluid. They did not know that the foxglove plant contains powerful cardiac glycoside digitalin and digitoxin, which are still used in the modern heart medication digoxin. But they knew that it worked. However, a plant like foxglove also highlighted the terrible knife-edge danger of their herbal pharmacy. The difference between a therapeutic, life-saving dose of foxglove and a fatal, heart-stopping overdose is incredibly small. So how did they handle these potent and dangerous plants? How did they control the dosage? This is a question that historians still argue about, because it gets to the heart of whether their practice was a sophisticated craft or a dangerous game of chance. One side of the argument holds that experienced herbalists and apothecaries possessed a deep, practical, and unwritten knowledge of their craft, passed down through generations of masters and apprentices. They knew, through long experience, exactly how many leaves to use. They knew that a plant's potency could change depending on the time of year or even the time of day it was harvested. They knew that some preparations required fresh leaves while others required them to be dried in a specific way. They knew how to combine certain plants to enhance their effects or to mitigate their toxicity. In this view, their craft was a precise, if unwritten, science of careful preparation. The other view is more skeptical. It argues that without the tools of modern chemistry to analyze a plant's active ingredients and without standardized weights and measures, dosage was largely a matter of guesswork and luck. The potency of a plant can vary wildly from one specimen to another, depending on the soil it grew in, the amount of sun it received, and a dozen other factors. One batch of a pain-killing potion might be perfectly effective and safe. The next batch, made with the same recipe, but with a more potent batch of herbs, could be a fatal overdose. From this perspective, every dose of a powerful herbal medicine was a dangerous gamble. This danger becomes even more apparent when we move from the beneficial plants to the truly poisonous ones that were a regular and accepted part of the medieval medical toolkit. Their pharmacy was, in essence, also a poison cabinet. The key, they believed, was in the dose. Consider the infamous nightshade family. Deadly nightshade, or Atropa belladonna, is one of the most toxic plants in Europe. Ingesting even a small amount can cause delirium, hallucinations, and a swift, agonizing death. Yet, in tiny, carefully controlled doses, its active ingredient, atropine, acts as a powerful muscle relaxant and sedative. Medieval physicians would use it in ointments to treat muscle pain, or in potions to calm a manic patient. The very name belladonna, which means beautiful lady in Italian, comes from the practice of women from the era using drops of nightshade extract to dilate their pupils, a cosmetic effect they found alluring, despite the fact that it made their pupils vision blurry. Henbane was another powerful hallucinogen and poison from the same family, used in small amounts in plasters and ointments for its pain-killing and sedative properties. And then there was the mandrake, a plant steeped in folklore and superstition. The root of the mandrake is famously forked and gnarled, often resembling a small, twisted human figure. The lore surrounding it was terrifying. It was believed that when a mandrake root was pulled from the ground, it would let out a blood-curdling scream so powerful it could kill any human who heard it. Special rituals were devised to harvest it, often involving tying a rope from the plant to a dog, which would then pull the root from the ground and die from the scream, sparing the human harvester. This fearsome reputation was due to the plant's real and potent narcotic properties. It was a powerful anesthetic and hallucinogen, a key ingredient in the most potent sleeping drafts and pain-killing concoctions. This brings us to one of the most remarkable and daring of all medical practices: the creation of the soporific sponge, a crude but ingenious form of general anesthetic. Imagine you are the patient who requires a major, excruciatingly painful operation, like a limb amputation or the trepanation we discussed earlier. The surgeon knows you will not be able to endure the pain while conscious, so he calls for the soporific sponge. This was a simple sea sponge that had been soaked in a potent and potentially lethal cocktail of narcotic and poisonous plant extracts. The recipe varied, but the key ingredients were almost always the same: opium from the opium poppy, mandrake root, henbane, and sometimes even hemlock, the same poison that was used to execute Socrates. The sponge would be soaked in this powerful brew and then left to dry in the sun. When it was time for your operation, The sponge would be remoistened with warm water. It was then held firmly over your nose and mouth. You would be instructed to breathe deeply. As you inhaled the fumes rising from the sponge, the powerful cocktail of alkaloids would enter your bloodstream, and you would, hopefully, fall into a deep, death-like stupor, or a state of complete unconsciousness. The surgeon could then perform his grisly work while you were insensible to the pain. The risk, of course, was astronomical. The dosage provided by the sponge was completely unpredictable. Too little, and you would awaken in the middle of the operation in unimaginable agony. Too much, and you would simply never wake up at all, your respiratory system paralyzed by the potent neurotoxins. Every time a surgeon used the soporific sponge, he was rolling the dice with his patient's life, gambling that the dose would be just right. The dual nature of these plants meant that the knowledge of the herbalist was also the knowledge of the poisoner. The same plants could be used to heal or to harm. An ambitious courtier could go to an apothecary and buy a selection of herbs to create a sleeping draught to help with his insomnia. Or he could use that same knowledge, and perhaps those same herbs, to create a subtle and untraceable poison to eliminate a rival at court. The only difference was the dosage and the intent, and given the variability of the plants themselves, it is certain that many deaths were not intentional poisonings at all, but simply tragic accidents. A case of a healer misidentifying a plant or miscalculating a dose. The line between a healing garden and a graveyard was often perilously thin. You are brought a small earthenware cup containing a dark, bitter-smelling brew. The physician tells you it will help you sleep through the pain of your ailment. You recognize the aroma of some of the herbs from the monastery garden. But you also know that plants have a secret and dangerous power. You say a quiet prayer, place your trust in the ancient knowledge of the herbalist and the wisdom of your physician, and you drink it down. This vast pharmacopoeia, drawn from the living earth, was a world of powerful and dangerous dualities, of healing and of poison. But for the medieval mind, there was another, even stranger layer of logic to be found in the garden, another way of understanding the healing power of plants that had nothing at all to do with their chemical properties or their humoral qualities. It was a philosophy based not on what a plant did, but on what it looked like. We must now enter the wonderfully strange and deeply symbolic world of the doctrine of signatures. The medieval pharmacy was a weird and wonderful place, a treasure chest of remedies drawn from every corner of the animal kingdom. Its logic was a complex tapestry, woven from threads of humoral theory, sympathetic magic, careful observation, and deep-seated superstition. But the animal kingdom, for all its strange offerings, was only one wing of this great pharmacy. An even larger, more complex, and more immediately accessible world of cures grew directly from the earth itself, in the leaves, the roots, the flowers, and the seeds of the world's plants. But there was another layer of logic to be found in this garden, another way of understanding the healing power of plants that had nothing at all to do with their chemical properties or their humoral qualities. It was a philosophy based not on what a plant did, but on what it looked like. We must now enter the wonderfully strange and deeply symbolic world of the doctrine of signatures. The core idea behind this doctrine is as beautiful as it is simple. You believe that God, in his infinite wisdom and mercy, did not create a world full of diseases and afflictions without also providing the cures. And, being a benevolent creator, he did not want to make these cures impossible for his children to find. Therefore, he placed a clue, a sign, a signature, on the very plants he intended for our use. He designed them in such a way that their appearance would give a clear visual hint as to what ailment they were meant to treat. The natural world was not just a random collection of flora. It was a great, living, divinely written encyclopedia of medicine. Your job as a physician or a simple herbalist was not to invent or discover, but simply to learn how to read the visual language that God had written into the very fabric of creation. Once you understand this principle, you begin to see the world in a completely new way. You walk through a forest or a monastery garden, and it is no longer just a collection of green and growing things. It is a library of divine clues, a gallery of living symbols, each one waiting to be deciphered. The most famous and perfect example of this doctrine is the walnut. You pick one up and hold it in your hand. The hard, woody shell is a clear representation of the human skull. You crack it open, and the resemblance is even more astonishing. The kernel inside looks exactly like a miniature human brain. It has two distinct, symmetrical hemispheres. Its surface is covered in convoluted folds and wrinkles, just like the cerebrum. The signature could not be more obvious. Therefore, God clearly intended the walnut to be the premier medicine for all ailments of the head. It was prescribed for treating headaches, for improving memory, for counteracting the effects of mental illness, and for healing head wounds. This logic is applied everywhere you look. You see a small, delicate wildflower growing in a meadow. Its petals are streaked with fine red or purple lines, and it has a single yellow spot at its center, making the entire blossom look for all the world like a tiny, bloodshot human eye. This plant is called eyebright, and its signature is clear. It was the go-to remedy for any and all eye problems, from simple irritation and styes to serious infections and failing vision. You would make a tea from it to be drunk, or a lotion to be applied directly to the eye. You find another plant growing in the damp soil of the forest floor, a plant with distinctive three-lobed leaves. You look at the shape of the leaves and you realize they look uncannily like the lobes of a human liver. This plant is known as liverwort or hepatica. Naturally, it was considered the primary medicine for all liver complaints. If a patient was suffering from jaundice, a condition that turns the skin yellow and was known to be a disease of the liver, they would be given potions made from liverwort. Nearby, you might find a plant whose broad, mottled leaves are covered in pale, speckled spots. To the medieval eye, these spots resembled the diseased and damaged tissue of an afflicted lung. This plant was therefore called lungwort, and it was the sovereign remedy for all respiratory conditions. For a cough, for shortness of breath, for any congestion in the chest, a tea or a syrup made from lungwort was the obvious prescription. The plant carried its purpose written on its very leaves. This system of visual correspondences extended throughout the entire pharmacy of the natural world. In a rocky area, you might find a tough little plant called saxifrage. Its Latin name literally means stonebreaker, because this hardy plant was known for its ability to grow in the narrowest cracks of rocks and boulders, its roots slowly but surely breaking the stone apart as they grew. The signature here was not in its appearance but in its action. If it could break great stones outside the body, then surely it could break down the painful kidney stones and gallstones that formed inside the body. Another plant, which had small, white, tooth-shaped nodules along its root system, was known as toothwort, and was, of course, used to treat a toothache. The root of a plant known as snakeroot was long, thin, and twisted, looking very much like a small snake. It was, therefore, the most logical and potent antidote for a snake bite. But where did this strangely intuitive, poetic, and entirely non-scientific system of medicine come from? Was it an ancient form of folk wisdom, or was it a later, more formal intellectual invention? This is a question that historians of medicine and science still argue about. The argument for it being an ancient folk tradition is a strong one. It seems logical that in pre-literate societies where knowledge had to be passed down orally from one generation to the next, such visual clues would be an incredibly useful mnemonic device. It is much easier to remember that the eye-shaped flower is for eye problems than it is to memorize a long list of abstract plant names and their uses. In this view, the doctrine of signatures is not a formal doctrine at all, but a codification of a deep, ancient, and cross-cultural human tendency to find meaning and connection in the appearance of the natural world. The great herbalists of the late medieval and Renaissance periods, like the famous Swiss physician Paracelsus, were not inventing a new system, but were simply collecting, organizing, and giving a fancy Latin name to a form of folk wisdom that had existed for thousands of years. The other side of the debate argues that while some simple folk connections probably existed, the fully fledged and systematic doctrine of signatures was primarily a scholarly and intellectual construct, developed specifically by thinkers like Paracelsus in the Renaissance. These thinkers were in a state of rebellion against the old medical system of Galen and the Four Humors, which they saw as a pagan, Greco-Roman inheritance. They wanted to create a new pharmacology that was explicitly Christian. The doctrine of signatures provided the perfect framework for this. It was a way of seeing the hand of the Christian God in every leaf and flower. Nature was a divine text, and botany became a form of theology. By deciphering the signatures, you were not just finding a cure, you were uncovering the hidden, benevolent plan of the Creator. In this view, the doctrine was less an ancient folk tradition and more a piece of early modern religious and philosophical propaganda. In your world, however, this is not a debate. The doctrine of signatures exists alongside the theory of the Four Humors as another powerful tool for understanding the world. They are two different, sometimes overlapping, and sometimes competing systems of logic that you can use to find a cure. Your physician might prescribe a hot herb for your cold condition, a decision based entirely on humoral theory. But he might also prescribe a heart-shaped leaf for your heart palpitations, a decision based on the doctrine of signatures, even if that leaf's humoral properties were not a perfect match. The medieval medical mind was perfectly capable of holding both of these ideas at the same time. If one system didn't provide a clear answer, you could simply turn to the other. It was a multi-layered approach to healing. A modern observer might call this intellectually inconsistent. You would call it having more tools in your toolkit. Of course, the system was profoundly flawed. The resemblances between plants and human body parts are, for the most part, entirely coincidental. The fact that a walnut looks like a brain is a curious quirk of nature, not a divine medical instruction, and the doctrine could be incredibly dangerous. As you know from our previous exploration of the herbal pharmacy, many plants are deadly poisonous. A belief that a certain plant is safe and beneficial to the liver simply because its leaves are liver-shaped could easily lead to a fatal case of accidental poisoning. The map provided by the signatures did not always lead to a safe harbor. You walk through a physic garden, but you see it now with new and enlightened eyes. It is not just a random assortment of plants. It is a living puzzle, a divine instruction manual written in language of shape, color, and form. Every lobed leaf, every spotted flower, every twisted root is a potential sign, a secret code waiting to be deciphered, a personal message of hope left for you by a benevolent God. This belief that the world was filled with hidden healing messages was a source of great comfort, order, and intellectual wonder. It transformed the natural world from a simple collection of resources into a sacred text. But even the most powerful herbs, chosen according to their humoral quality or their divine signature, sometimes failed. In cases of the most dire illness, the most terrifying pestilence, or the most grievous wound, you and your physician would turn to a higher power, to a form of medicine that was believed to be more potent than any earthly remedy, more powerful than any earthly remedy, the influence of any star. You would turn to the direct, miraculous intervention of the holy saints. It was a way of seeing God's hand, his divine plan, in every leaf and flower, making botany a form of theology. By deciphering the signatures, you were not just finding a cure. You were uncovering the hidden benevolent plan of the Creator. But sometimes, the remedies of the earth and the skill of the physician were not enough. In cases of the most dire illness, the most terrifying pestilence, or the most grievous wound, when all the arts of humoral rebalancing, astrological timing, and herbal medicine had failed, you would turn to a higher power. You would appeal to a form of medicine that was believed to be more potent than any earthly remedy. more powerful than the influence of any star. You would seek the direct, miraculous intervention of the holy saints. Imagine now that your long and painful illness has resisted every treatment. The physician has bled you, but the fever returns. He has examined your urine and prescribed diets of opposing qualities, but your condition worsens. The barber surgeon has offered his terrifying tools, but your ailment is beyond his craft. The herbalist has given you potions both benign and poisonous, but nothing has worked. You have reached the end of the line for earthly medicine. There is one final court of appeal. In your world, the line between medicine and miracle is not just thin, it is entirely non-existent. The practice of medicine is not complete without the practice of faith. Your hope now rests with the cult of saints. The saints in your belief system are the great heroes of the Christian faith, individuals who lived lives of such extraordinary holiness that upon their death they ascended directly into heaven. There they dwell in the immediate presence of God. They are not distant or forgetful. They are your powerful friends in the celestial court, because they once lived in mortal bodies and endured the same sufferings as you. They are believed to have a special sympathy for the plight of struggling humanity. They are your advocates, your intercessors, your spiritual lobbyists, who can take your desperate prayers and present them directly to God Himself. And crucially, this heavenly court was highly specialized. Just as you would go to a guild of weavers for cloth and a guild of bakers for bread, you would go to a specific saint for a specific ailment. The medieval world had a patron saint for almost every conceivable disease and misfortune, each one's specialty usually linked, often in a rather grim fashion, to the story of their own life or martyrdom. If you are suffering from a terrible toothache, the kind of deep, abscess-related pain that was so common in your time, you would direct your prayers to Saint Apollonia. She was a deaconess in ancient Alexandria who, during a persecution of Christians, was arrested and had all of her teeth systematically and brutally smashed and pulled out before she was martyred. Because she had endured the ultimate dental suffering, she became the go-to patron saint for anyone with a toothache. A prayer to Saint Apollonia was your first, and perhaps most effective, line of defense against the terrifying prospect of a visit to the barber surgeon. If you had a sore throat, or if your child was choking on a fishbone, you would pray fervently to Saint Blaise. He was a bishop in Armenia in the 4th century, who, according to legend, miraculously saved a young boy who was choking to death. To this day, in some Christian traditions, the blessing of the throats is still performed on his feast day. If you were a new mother, terrified of the high rates of infant mortality, you would pray to Saint Nicholas, the same saint who would evolve into the modern Santa Claus, who was believed to have miraculously resurrected 3 dead children. If you were suffering from the painful and embarrassing affliction of hemorrhoids, you would offer a quiet, perhaps shamefaced, prayer to Saint Fiacre, a 7th century Irish hermit who, as the story goes, developed the condition from spending too much time sitting on a hard, cold stone in prayer and was miraculously cured. There was no ailment so great or so small, so deadly or so undignified, that it did not have its own dedicated specialist in heaven. The patron saint of burns was Saint Lawrence, because he was martyred by being roasted alive on a gridiron. The patron saint of skin diseases was Saint Bartholomew, who was flayed alive. The logic was simple. The saint who had suffered the most from a particular affliction was the one who would have the most sympathy for you and the most influence in that department. But how did you access the healing power of these saints? It was not enough to simply pray. To truly tap into their miraculous energy, you had to come into contact with their physical presence, with the sacred power that lingered on earth in their relics. A relic was a physical object connected to the saint. The most powerful, a first-class relic, was a piece of the saint's own body, a finger bone, a tooth, a lock of hair, a fragment of their skull. A second-class relic was an object that the saint had owned or frequently touched, like a piece of their clothing, their prayer book, or the instrument of their martyrdom. These relics, housed in magnificent jewel-encrusted containers called reliquaries, were believed to be conduits, powerful spiritual batteries charged with the saints' healing grace. And so, to seek your cure, you must undertake a pilgrimage. This was the ultimate form of medieval medical tourism. The journey might be a short one, a day's walk to a local church that happened to house the shin bone of a local saint. Or it could be a massive, life-altering and expensive journey of hundreds, or even thousands of miles across multiple countries to one of the great healing shrines of Europe. You might vow to travel the Great Pilgrim Road to Santiago de Compostela in Spain, to the tomb of St. James. Or you might journey to Canterbury Cathedral in England, to the shrine of St. Thomas Becket, who was particularly famous for curing blindness and leprosy. Imagine yourself arriving at one of these great shrines. The atmosphere is thick with a powerful mixture of desperation and ecstatic hope. The church is thronged with hundreds of other sick and suffering pilgrims. You see people on crutches, people with visible tumors, people with skin diseases, the blind, the lame, the deaf. It is a great gathering of human misery, all focused on one single point of hope. As you get closer to the shrine, you see that the walls around it are covered with small wax models of body parts, legs, arms, eyes, hearts left behind by pilgrims who have been cured. A testament to the saint's power. These are known as ex-votos. Finally, after hours or even days of waiting, it is your turn. You approach the magnificent golden reliquary. A priest might be standing guard, and he might allow you to kiss the reliquary, or to touch it to the part of your body that is afflicted. Or, more commonly, he might take a cloth, touch it to the sacred relic, and then touch that cloth to you, transferring the healing power. In this moment, you are filled with an immense soaring wave of faith and hope. You have traveled for weeks, you have prayed, you have fasted, you have confessed your sins. You are now in the direct presence of the holy, and you are ready to be healed. And the medieval chronicles and the records of the shrines themselves are filled with thousands of accounts of people who were, in that moment, miraculously cured. The blind suddenly regained their sight. The lame threw down their crutches and walked. The sick were made well. But what was really happening in these emotional, faith-drenched encounters? This is a question that historians, sociologists, and medical professionals still argue about today. The medieval explanation, of course, was that these were genuine, divine miracles, a direct intervention by God in the natural world, prompted by the intercession of his saint. For the faithful, no other explanation was needed. Modern science, however, offers other potential explanations. Many illnesses, particularly those not caused by severe trauma or aggressive infection, are self-limiting. They will eventually get better on their own. It is entirely possible that a person suffering from such an ailment would undertake a long and arduous pilgrimage over many weeks or months. Their natural recovery might happen to coincide with the exact moment they finally reached the shrine. The timing would seem miraculous, and the cure would be gratefully and logically, in their worldview, attributed to the saint. There is also the incredibly powerful influence of what we now call the placebo effect. The human mind has a profound ability to affect the body. If you believe with every fiber of your being that you are about to be healed, your brain can release endorphins and other chemicals that can genuinely reduce pain and promote well-being. The entire experience of a pilgrimage was perfectly designed to maximize this effect. The long, difficult journey focused your mind and your will. The powerful, emotional atmosphere of the shrine, surrounded by hundreds of other intensely believing people, created a state of heightened suggestibility. The final dramatic touch of the holy relic was the trigger that could unleash the body's own latent capacity for healing. The cure, in this view, came not from the saint's bone, but from the patient's own mind. And finally, one must also consider the possibility of simple, earthly fraud. The keepers of a shrine, monks or priests, had a powerful vested interest in maintaining and promoting its reputation for miraculous healing. A famous shrine attracted more pilgrims, and more pilgrims meant more donations, more wealth, and more prestige for their church or monastery. It is not cynical to assume that some of the reported cures may have been exaggerated, or that a shrine's keepers might have encouraged people to believe they had been healed, even if their condition was unchanged. You kneel in the flickering candlelight of the great church, your head bowed before the golden, jewel-encrusted reliquary of Saint Apollonia. You have traveled for weeks to get here. You have prayed until your voice was hoarse. You touch the cold metal of the reliquary, and you send one final desperate prayer to the holy martyr, begging her to intercede on your behalf, to cure the agonizing, relentless pain in your jaw. This final, profound reliance on the supernatural was not, for you, an alternative to medicine. It was medicine. It was the highest and most powerful tier in a complex and multi-layered system that encompassed the humors, the stars, the animals, and the plants. It was the ultimate court of appeal, the place where the failures of earthly science could be redeemed by the limitless power of heavenly grace. It was the final, humble admission that all health and all healing were, in the end, a divine mystery that lay in the loving hands of God. And here, kneeling in the cool, silent candlelight before the jewel-encrusted bone of a long-dead saint, our strange and sometimes terrifying journey through the world of medieval medicine finally comes to its end. We have tasted the urine and charted the stars. We have seen the wounded man in all his gory glory and witnessed the terrible courage of the trepanned. We have explored a pharmacy of animal parts and poisonous plants. The story of this bizarre and complex world is now told, and its images can begin to soften and fade, dissolving into the warm and peaceful quiet of your own room. Let the memory of these strange treatments recede. The sharp sting of the lancet, the grating sound of the trepan, the bitter taste of a herbal potionlet, these sensations melt away. They belong to another time, a world of suffering and desperate hope that is far removed from your own. The people of that age endured these things because it was the best they knew, the most logical and scientific path they could see. Their world of medicine, so alien to us, was their reality. But it is not yours. You can now allow yourself to feel the simple, profound comfort of your own reality. The body you are in is not a mysterious vessel of warring humors. It is a biological marvel that you understand in a completely different way. You are resting in a room where the air is not filled with the threat of miasma, but is simply still and calm. The science of your own age, for all its complexities, has freed you from the fears and the flawed logic that govern the world we have just visited. You are safe. You are well. And you are at peace. Think now not of the patient's fear, but of the feeling of a fever finally breaking. Think of the immense soul-deep relief that comes when a long period of pain is over. Let that be the final feeling of our journey tonight. A sense of a trial ended, of a struggle concluded, of a peace finally won. Let the quietness of the church we just left behind fill your own room. A silence not of anxiety, but of sanctuary. As the last echoes of this distant world fade, become aware only of the simple, gentle rhythm of your own breathing. It is a quiet and steady beat, a soft and natural tide. It is the sound of your own body at rest, your own systems in their perfect sleeping balance. Let this sound be your guide now, leading you away from the world of stories, away from the past, and into the deep, untroubled, and restorative country of your own dreams. The journey is over. The lesson is learned. It is time to rest. Let the past dissolve. Let the quiet hold you. Let your mind be at ease. Sweet dreams.